Hello, everyone, and welcome to today's webinar. We are so thrilled to have this conversation with you all and to bring to you this really important training on lessons learned from implementing SSI, SSDI Outreach, Access and Recovery, the SOAR model, the strategies in medical respite programs and health centers. My name is Katie League. I am the Behavioral Health Manager at the National Healthcare for the Homeless Council, and I'm joined today by my colleague Stephen at the Council, Kristin Lupfer from the SOAR TA Center, and some incredible panelists to share with you their insight and wisdom today. We are also delighted to have ASL interpretation services as part of this webinar. It is why we are using this format, which might be a little new to some of you, but we're really thrilled to improve our accessibility for many and welcome you to utilize the chat throughout our training today to ask questions, to connect with one another. And we're going to get underway. A brief disclaimer, this opportunity has been made available entirely thanks to our cooperative agreement through HRSA, the Health Resources and Services Administration. The content of this webinar and the conversation today are those of our authors and presenters and do not necessarily represent the views of nor an endorsement by those government entities. A quick introduction and thank you to our incredible presenters and panelists today. This conversation brings with it so much brilliance and insight from programs and staff across the country that have been doing incredible SOAR work. And we are thrilled to bring to you some of the conversations that we have been able to have and really excited to share with you a publication that we'll talk a little bit more about. A brief overview of our agenda. Here I am welcoming you, so grateful to have you with us. I'm going to momentarily turn it over to Kristin Lupfer from the SOAR TA Center to do some level setting for SOAR. As I mentioned, my colleague Stephen is going to chat about our new publication we are excited to share with you. And then we are going to delve into our conversation with our incredible panelists that we're really excited to share with you their insights in the SOAR work that they are doing within their communities. And as I said, we welcome you to utilize the chat feature to add your questions. Thank you to those who did it as part of registration. We will be sure to include as many of those questions as we can get to today. And without further ado, I'm going to hand it over to Kristin.
All right, thank you so much, Katie. I'm so glad to be joining you all today. So I'm only going to speak really briefly. I wish I could talk to you for hours about SOAR, and if anyone wants to have that conversation later, I would love to talk with you. But we just want to make sure that we're all kind of on the same page as we go into a really great discussion about utilizing SOAR in your health centers. So SOAR is really a model for assisting eligible individuals to apply for Social Security disability benefits. We are focused on individuals who are experiencing or at risk of homelessness, who have either a serious mental illness, co-occurring substance use disorder, or other physical disabilities. We are sponsored and funded by SAMHSA and work in close collaboration with the Social Security Administration and have been doing so since 2005, so for the last 20 years. All 50 states in Washington, D.C. currently participate in the SOAR model and SOAR work in some way, and we'll talk about getting connected to those folks soon. Next slide. Okay, so some real basics about Social Security disability benefits. There are two programs that SSA administers: Supplemental Security Income, or SSI, and Social Security Disability Insurance, or SSDI. The acronyms for both programs are actually really helpful in distinguishing between the major differences. So SSI is a program that is based on need, and it's for individuals who have low income and resources. And so it's a supplemental income. You can kind of make that connection there. And SSDI, eligibility is based on an insured status. So for those individuals who have worked, paid into the system through those FICA taxes, and are now insured for disability for either themselves or certain family members. So it's an insurance program for those people who've worked and paid in. So you can see those two differences there. Because SSI is a needs-based program, where you live and what other support you have and what income and resources you have will impact both your eligibility and the amount of your benefit rate. The maximum federal benefit rate in this year, in 2025, is $967 a month. Some states have a supplement to that, but based on other earned or unearned income, that amount can go down. The date of eligibility for SSI, it's based on when you apply and your application date. So it's really about a here and now benefit. And it is generally comes with Medicaid and automatic Medicaid eligibility in most states. For SSDI, the monthly amount is actually based on your own personal earnings history. So if you log into your My Social Security account, and if you don't already have one, I encourage you to sign up. You can check to see both your earnings history, but then also what your benefit would be if you became disabled. The date of eligibility for SSDI, it's based on your date of onset of disability, when your disability began. And then there's a 5-month waiting period from that date. So there's a little bit more nuance to when benefits can start. Sometimes if your date of onset is in the past and you've waited to apply, there are retroactive benefits available. The health insurance program that's associated with SSDI is Medicare, and generally there's a 2-year wait for eligibility for Medicare. So that's just a consideration there. Some people can be dual eligible for both programs and kind of have Medicaid as a bridge health insurance until they're Medicare eligible. We will get into all of those weeds, lots of more information that you can learn in the SOAR online course. On the next slide. So that was mostly the non-medical eligibility for the disability programs. But what is key and the same for both is the medical eligibility definition, right? And so for those adults who would be eligible for Social Security disability, they must have a medical condition that's diagnosed by an acceptable medical source. So they have to have medical records and documentation of that illness or condition. And it has to have lasted or be expected to last at least 12 months or be expected to result in death. So this is not for short-term disability. It must be a full year or it will result in death. And not only that, so you must have medical condition, evidence of that condition, and that it will have a long duration, but also that it is causing functional impairment. And what we mean is that the illness or condition is so severe that is impacting your ability to work at what Social Security calls a substantial gainful level. So that's based on a set number of earnings per month. And in 2025, that amount of earnings is $1,620. So if you're able to work and earn at that amount, no matter how many conditions you may be diagnosed with and managing, you aren't eligible for disability. However, if your illnesses or conditions are impacting your ability to earn that amount, and let's say you're only able to work some, you're earning about $1,000 a month, you could be eligible. My point in mentioning that is that this does not preclude all work, and many people who are working part-time or working sporadically can still be eligible for Social Security disability, so long as their earnings are under that substantial gainful level. On the next slide. So we say SOAR is for everyone. And what we mean by that, it is for all individuals who would meet those disability criteria, across the lifespan. So there are disability benefits available to children through the SSI program. So we have information for children and youth and adults and older adults. We have resources and information available for specific populations, for our Native communities, for our veterans, specific considerations for those populations. And we can have seen SOAR successfully implemented across systems through education and employment in the foster care system and legal systems with pre-release. So we love to see kind of SOAR implemented across all of these populations and systems. Next slide. We see access to Social Security disability benefits really as a foundation for recovery and resiliency. It is not the end goal. We see a combination of these benefits, earnings from employment, access to health insurance as this foundational level for the higher level things we're working towards, housing and increased engagement with treatment and support services, and ultimately achieving the wellness and recovery that we're all hoping for. So it really is more than just income. It is access to healthcare and housing and education and employment, and it's decreasing expensive and disruptive incarcerations and hospitalizations. Next slide. We hope, if you aren't already, that you all get involved with SOAR. I mentioned the SOAR online course. It is the training curriculum for how to implement the SOAR model and has a lot of really great detailed information about both eligibility, the application process, and how the SOAR model is implemented with critical components that help to increase approval rates on disability applications. We want to get it right the first time and as quickly as possible so that people are accessing the benefits that they need. So we've got some getting involved information. We'll put links in the chat where you can find more information about how to get involved with SOAR in your community. On the next slide, you'll see in our state directory, you can contact a SAMHSA SOAR TA Center liaison who can help give you information about SOAR in your community. So there might be, many other active SOAR providers in your area, or you may be the first one who is trained and can offer the service to individuals in your community. So it's a great opportunity to get involved. And I think on the next slide, we'd love you to sign up for the SOAR email list. We send out helpful information and updates that we would want to keep connected with you all. And I'll turn it over to Stephen.
Thanks so much, Kristin. That was a really great overview of the topic. Appreciate you being here. Good afternoon, everyone. My name is Stephen Wilder. I'm a member of the medical respite team here at the council. I want to take a moment to highlight a new resource we have available that we're thrilled to be able to share with you that Katie mentioned earlier. So we released a publication earlier this month, really exploring opportunities to effectively utilize the SOAR model, specifically in health centers and medical respite care program contexts. So we began way back in 2023, conducting some pretty extensive series of focus groups and interviews. We spoke with 30 individuals representing 18 organizations and lots of different perspectives. So program administrators, SOAR caseworkers, clinicians of various disciplines, some SOAR local leads for their communities, and really importantly, people with lived expertise who had benefited from the SOAR model. So that served as kind of our primary data source for this project. And then we supplemented that with a review of relevant literature, kind of around the intersection of homelessness and disability and healthcare systems. And we were also lucky enough to have some really wonderful subject matter experts who contributed to this project, including a SOAR state lead, our friends at the SAMHSA SOAR Technical Assistance Center, who really helped us plan and implement this project, reviewed our draft materials, and just really enriched the final resource quite a bit. So this publication synthesizes key themes and takeaways that really emerged over the course of this project and that we feel are most relevant to health centers and medical respite practitioners. So it's full of really valuable firsthand experience and direct quotes from those who are actually on the ground doing this work day in and day out. While we don't have time to really dig into the findings in this webinar, I do want to touch on kind of the three broad focus areas of the publication. So it looks at how SOAR is currently utilized within health centers and medical respite programs, the impact that that has. So what's the importance and the significance of SOAR work for folks who are using services in these programs, for the organizations and their communities. And then finally, and most importantly, the bulk of the resource focuses on strategies for optimizing SOAR initiatives within these settings. So really looking at how can we make this work most effectively. So there's a QR code on your screen. I put a link to the publication in the chat earlier, and we really hope you'll take some time to look at this, share it with others in your organization who you think might find it interesting. And we just hope that it'll be useful to you, that'll serve to support the really important work that you all are doing in your communities. And with that, I think I will pass it back to Katie to kick off our discussion with our wonderful group of panelists.
Thank you so much, Kristin and Stephen. We are gonna pull down our slides, so bear with me for just a moment as we invite our panelists from backstage to join us. Thank you all. Wonderful. Excellent. So glad to have you all with us. Depending on how you all are viewing it, you hopefully now see all of us. I am thrilled to be joined by some real experts that are doing this work on the ground. First, Charita McCollers, who is a social worker and SOAR local lead at Lincoln Community Health Center in Durham. And then Dorothy, Slama, and Traci Fuglestad, along with Nikki, who are joining us from the Sulzbacher Center in Jacksonville, Florida. We are so grateful to have you with us today. And I'm hopeful to just start by having each of you introduce yourselves, give a few sentence introduction about your connection with SOAR and this work. This entire group joined us for those conversations that Stephen was mentioning, and they were invaluable in informing our publication and making sure that it was rooted in direct practice and community experience. So Dorothy, why don't I start with you? Can you introduce yourself?
Yes, I'm Dorothy Slama. I'm a nurse administrator here at Sulzbacher, and so I oversee our medical respite program. So I am lucky enough to have actually 2 case managers that work with our clients. And then we have Traci, who is a wonderful SOAR case manager, and her connections with the clients can mean that they are more stable and better able to move into more permanent solutions as they come through our program. So we're very happy to have that connection and blessed that we have Traci's work.
Traci, would you like to introduce yourself? And Nikki, I'd love for you to introduce yourself as well.
So hi, my name's Traci Fuglestad. I'm a SOAR social worker here at Sulzbacher, and I'm the lead for the Jacksonville area. And one of the benefits I think of working here at Sulzbacher is I'm able to form all these partnerships, like with Nikki was Ability Housing, which is a permanent supportive housing program. But here at the Sulzbacher campus, we have Respite, we have a medical clinic, we have a behavioral health clinic, we have a pharmacy, we have therapists, and we have a dental clinic. So when I get these individuals who are either literally homeless or at risk of homelessness, I'm able to bring them to my office here on campus and link them to behavioral health, medical, pharmacy, therapy, dental, and all the other. And there's also a site is called, I'm sorry, Urban Rest Stop. It's called the Urban Rest Stop, where people can go, they can get their meals sent if they are homeless, they can access showers, they can get meals, 3 meals a day. So everything here on campus kind of helps individuals that are experiencing homelessness or untreated mental illness or medical problems have that quick access to wraparound services.
Thank you, Traci. Welcome. Nikki?
Hi, my name is Nikki Gates. I'm a recent graduate of the SOAR program.
Wonderful. Thank you so much for both of you for joining us. We're really excited to have this conversation with you. Charita, can you introduce yourself?
Hello, everybody. My name is Charita McCollers. As Katie introduced me, I am a local lead in North Carolina, in Durham, North Carolina, but I am actually a local lead and a SOAR worker. So, and I have been doing SOAR since 2011. And I am the only one in my FQHC who does SOAR. And we are the safety net for provider for about 60,000 people in our city. And I am housed at the Healthcare for the Homeless Clinic. And much like the things that Traci shared, we have a lot of services on site, some off site, but I do a lot of, not just the SOAR, but also kind of coordinating the care to be able to highlight the challenges and the deficits and the needs that people have as we're going through the SOAR process.
Thank you, Charita. And yes, I should also share that my first work in the Healthcare for the Homeless community was at Healthcare for the Homeless Baltimore, where I worked for almost a decade, and I was a SOAR outreach worker there. So I have some deep-seated interest and investment in this particular topic, and am just so inspired by the work that are being done across the country, and particularly in these 2 programs around SOAR. I got to see firsthand the difference it made in the lives of the people who were able to get benefits. And I also really appreciate the challenges of working it into your everyday work. And I've had the great fortune to know Charita for many years now, and I am reminded of the many, many hats that everyone on this call has to wear throughout the course of their day. And that SOAR worker is one of many really important ones, but often that it is one of many. And so I'm really looking forward to this conversation. So thank you all for introducing yourselves. I'd like to start with just a general question to all of you, and feel free to chime in whatever order you'd like. Why has SOAR been meaningful to the people that you work with?
I guess I'll take a stab at it. I think it's been meaningful because some of the folks that we serve, they just have not been able to maintain employment. And this has been a huge barrier to their stability. And oftentimes we come across people who've tried that process themselves, not fully understanding what, being deemed disability looks like. Oftentimes people think it's just, I have a diagnosis, therefore I am disabled. And it's so much more than that. And so they've, oftentimes tried this several times before they get to our doorstep, right? And just being able to, one, educate them on the process and understand, like, we're in partnership, and some of that partnership actually requires you to do some behavioral change. because you have to be willing to do some of the, you know, the things that you need to do to be able to prove that. And so I think SOAR presents itself as this opportunity to help people secure that income, but also like become healthier people because of it, right? The things that you have to do, the steps that you have to go through to prove that you can't function. In the end, if a person kind of keeps that stuff up, overall, the hope is that their care, their livelihood, their life experience changes in a positive way.
SOAR can often help people to regain hope. We get folks so often that, as Charita mentioned, have tried this already, and they may have been denied, or they may not have been able to finish the process. You know, being there for the telephone calls or getting their correspondence on time, or all the other barriers that happen, because it's a long process, and folks forget and don't stay on top of it, may not understand the process fully. So often people have been disappointed, and they need that extra support to complete the process. Even though they're very good candidates, they may not be able to do that without the really in-depth support that a SOAR counselor can provide.
And I just like to say that what the last two people have said is very accurate, because I myself have went through all the trials and tribulations of trying to get stable and get situated on my own, and trying to gain financial support from my Social Security, and was unable to by myself. I tried at least 5, maybe 6 times to do it on my own, and I was turned away many, many times. And not until I got in contact with the SOAR program and they started helping me was I able to start seeing results. Usually I would apply and get one letter just said denied, and that would be it, and it would be just that fast. I realized that once I started going through the SOAR program, the letters were different, the wording was different, the contact from them was different, much different, because they knew that we had someone working with us that was going to be able to stand firm and help us, you know. So it was very helpful to have SOAR along with ability housing to help me gain stable living situation, like y'all said, with the medical, getting the wraparound services with mental health, dental, medical, Medicaid, medications as well, because we have problems a lot of times getting our medication. The programs here helped us with everything as a whole. So I just like to thank everyone for the services that they offer us and provide us.
Thank you so much, Nikki. You answered really part of the question that I was going to ask you, which is, it sounds like you really felt a difference when you had the opportunity to work with the SOAR worker, and the communication even that you were receiving felt different.
Yes.
From your experience of applying through SOAR, what was it that, how do you think SOAR specifically helped you, or how did it feel different for you in the process application?
Like I said, even in the beginning, the communication from the disability people, the wording of the letters were different. I started receiving more than one letter because, as like I said before, when I would apply my own, I would just get one initial letter back from them, and it would just say denied. And it would tell me that I could do the appeal process and all that stuff, but it's that simply as all it was. But when the SOAR program started applying for me, the first letter that I received was not, I was denied. It was just requesting information. And it's the communication between me and the disability people just became more, it was more human. It was like I was able to feel like someone was listening. And I don't think that would have been possible without the SOAR program.
That's such an impactful statement that it did make it feel more human and less administrative or procedural, that there actually were people working on this, not just a process that kind of was happening behind a wall. Thank you so much for that.
Yes,
I think
ma'am.
that's a really important reminder for how we can not just hopefully help people get connected with benefits, but actually bring the human into the process. As Kristin was describing the difference between the two programs, I was reminded of how valuable just breaking down these two very large abstract concepts for many can be in making it feel more accessible for someone. And that's a real important value to having SOAR trained individuals within communities, embedded within health centers and medical respite programs, because there's people who can say, yeah, it sounds really complicated. Here are the key pieces you need to know. So with that, I'm going to ask to the panelists, why are healthcare for the homeless programs and health centers and medical respite programs particularly well positioned to engage in SOAR work?
Speaking to the medical respite program, when folks come to us, they have already some chronic condition and some acute exacerbation. So often they have some sort of disability, something that's preventing them from being able to care for themselves on their own. And then we are, by definition, the whole time they're in the program, working to help them become more stable so they can discharge to a more stable living environment and have those connections to primary care, mental health, dental, the social connections they need to remain stable and successful when they graduate from the respite program. So in many cases, folks don't have a source of income when they come to us. And it may be that whatever landed them in the hospital also took away that source of income. That's super common. So having SOAR to help them through the process, which may be brand new to them, of applying for benefits to help them become stable, can again restore that hope and help them to find a way to move forward when they're in a very scary situation, being both in unhoused or in unstable housing and having medical conditions that they're dealing with. We really want to help them find not only a way to get through this rough patch, but to have a plan for the future.
And I agree, kind of piggybacking on what Dorothy said, being at a center that attracts people experiencing homelessness and the, you know, the disabilities they live with that kind of led them to that is a lot of times there isn't any documentation. Somebody may have a serious form of schizophrenia or you know, or anemia or something. And so having them right there, I can link them and walk with them to the medical clinic to get them a, you know, a medical evaluation. Then I can go with them to the behavioral health clinic and get them a psych eval. And that generates documents. And then I can, you know, submit documents like the medical summary report and other type supporting documents that the psychiatric or medical staff will sign off on. And I think that's a big, huge component of getting them approved so quickly, is getting that current updated medical and behavioral health evidence. So to me, that's just I don't even know if I could really do it without having access to these clinics, you know, to be successful.
What I would add, I would imagine in a respite setting that you will also really be looking at people's functional ability and what they can and cannot do. So I think the other side of that is you're also seeing the manifestation of the health condition in real time and the deficits. And so that helps to paint like a really different kind of picture beyond just the diagnosis and seeing the doctor. Then there's the actual how the person operates and functions, that you can see that oftentimes in healthcare settings you might not get to see all of that. So for medical respite, that is huge. In our, well, I will say, from the perspective of my clinic is located on site at a homeless shelter. So one of the benefits from that functional standpoint is that we do have a really good relationship with our shelter staff. And so we're always like asking them to give us functional information. Like, what do you see this person doing? What is the challenge? Can they actually take their meds? Even when we fill a pill box, can they actually execute that? Things like that. I think the other thing that make us a good setting is because the medical records, the access is right there, right? So it's like a win-win situation. But I think going a step further is there are some healthcare providers that are so hesitant to do disability work. And I think medical respite settings, HCH specifically, just the way that we provide our care to people, we're doing that whole person integrated kind of approach to taking care of people. We're just really positioned. We, you know, our medical providers, even our front desk staff and our nursing assistants and nurses, we just have a certain way that we interact, deal with, help people. You know, our people come in the door sometimes and they're not always the nicest people. And it's a manifestation of those are the skills they learn to survive. And they feel like they have to bring those behaviors and those stances into every space they go into because they're not safe. And so I think one of the other things that we do really well is that trauma-informed approach and helping people have a safe space. And you have an opportunity to do a lot of work with people when they feel safe. You know, that not so nice person is not that person anymore. They're that person with all of the things that have happened to them, you know what I'm saying? And they're just trying to survive. And so I, you know, first and foremost, I would definitely say being able to see function in real time, the access to the medical records in a easier way. Even getting records from other places is easier when you're in a healthcare setting, right? So access to those records is really important. And then the third thing is like the staff training and how we work with people, how we chart. Because I've had some cases where I haven't had to do a medical summary report because the chart was the medical summary report, just because of the nature of how we serve and how we work. So, and that results in people getting benefits faster. I don't have to do a 13-page medical summary report because it's kind of already laid out. And so I just think we just fit really good with the SOAR model, just as a program. It just works.
Thank you all. Yes, and Charita, you really kind of hit upon a question that was just put in the chat around writing letters of support for patients. It sounds like you at least are describing it doesn't always even have to be a letter, but actually the way in which we document the whole person, not just specific things or thinking just from a billing perspective or maybe what the particular health condition a person came in to address on a given day was, but actually really, I mean, Nikki hit upon it perfectly around bringing the human into it and really being able to draw some of the connections that may feel obvious for those of us that get the opportunity to work with a person, but that the disability process needs the line to be, or the connection to be drawn between what somebody is experiencing or how it's impacting their ability to do the work that they'd like to do, and maybe that diagnosis or a health condition that they are facing. I think that that's such an important thing, that it doesn't always have to be a one lengthy document, but really baking it into our overall work can be helping a person's case, even if they're not yet ready to apply, right? You're building that evidence for them, even if that's not their current goal. You're documenting the realities of their experience at the moment. Nikki, I'd like to turn to you and ask if you can share how it has been, what has having benefits allowed you to be able to do, or how has it changed your ability to reach your goals?
It has changed everything tremendously. I'm able to buy myself personal hygiene items, household items for the month. I'm able to, I was able to take in the beginning, I was able to take my back pay money and purchase me a car. So I am back functionable and able to have contact with my family, like my grandmother who's 88 and cannot drive. And I was unable to get to her back and forth because I have a phobia about public transportation. So I've been stuck at home for the last 5 years without a car. So I've been able to have contact with my grandchildren. It's brought me financial stability where I'm able to pay for things that I need. I pay a housing share cost at my place where I live. In part, my utilities are a part of my bills for the month. It's made a tremendous change. And I'm sorry to keep stumbling, but it's overwhelming to know where I've come from and to where I am now. Just being able to function now properly, where I have stable living and a stable income and a car, it has put me back on track completely.
Not stumbling at all. You're incredibly eloquent and so helpful for us to remind us why we do it. Right? This is the why communities should invest effort. I am so grateful for you sharing your experience. Charita, please go ahead.
I think the other part and Nikki, I just thank you so much for being here. I thank you.
Thank you.
For being willing to share. I think the other game changer about SOAR is that oftentimes our folks end up with these attorneys. These attorneys are not, a lot of them are overwhelmingly not great. Like they're trying to figure out how to get the most money out of the person's pocket. And which means they want the case to go on as long as possible, right? And they don't always do a lot of work. And they still oftentimes rely a lot on the client to be able to execute much of the work. And if a person can't do that, it's just not a successful experience for a long time, right? And so I think the other game changer about SOAR is people being able to have access to back pay, to buy a car, to pay off maybe evictions or something that was hindering them from being able to secure housing. So I think, some of my patients have been able to go on a trip to see family in another state. They would have never been able to have that opportunity. And so I think the other part of that is when we are successful and people can get money that they were due a long time ago but couldn't navigate a process, that's also a game changer.
So true. Yes. And it brings with it the skills that each entity has, right? The lawyers are experts at the legal process, but before that, it is a very human process. And health centers, social workers, community health workers, this is where we are experts. And most importantly, centering the individual, because they are experts in their own life and they know the reality and the impact that their health has on their ability to reach their goals and what some of the barriers that they have faced to that point are. Kristin, I'm wondering if you could, there's a great question in the Q&A about how organizations kind of handle this. Who does the SOAR work, or what does position look like? I know there's lots of examples, but I was wondering if maybe you could maybe give some examples of what programs across the country are doing as kind of an encouragement for people that there's no wrong door, there's no wrong way to do this.
Yeah. Absolutely. Thank you for the question. And Katie, absolutely, there is no wrong position or wrong person for SOAR. I think the most important skill is a passion for this work and an interest in helping to really have this serious impact on individual lives. Like, I think that's that's like the number one thing I would look for in hiring a SOAR worker. We have, people from just a range of experiences and backgrounds, from peer specialists with lived experience who are doing this work with no formal education, but just the education of life and experience, and again, like passion and work, and we can train all the rest of it, right? We do that with the SOAR online course. And we have folks who have master's degrees and have lots of postgraduate education who are bringing to this work other kind of qualities or background, and so a range in between. So we see a lot of outreach workers, a lot of case workers or case managers or care coordinators. We see nurses and others, people who are kind of working in this direct service role and are really engaging with individuals and getting to know them. I think that that's such an important piece of it, is building this relationship like Traci has with Nikki, to really get to know the individual, what's going on with them, to help with the documentation of the claim and following through on it. So I think that relationship building piece of someone's role is huge.
Thank you so much. As we're starting to near the end here, I was hoping to pose to each of you, what are one or two strategies that have contributed to the success of the SOAR work within your programs, within your organizations? Go right ahead, Traci.
Okay. Providing good relationships with the providers, I think that has helped, and knowing like the behavioral health providers and medical providers, because I'm an employee here, so they kind of trust the process. They have been instrumental in helping me gather the medical evidence needed to get approval. So I would say building relationships and organization and documentation, those are the three main things to help bring about successful outcomes for getting their disability.
I would agree with Traci. I think for me, being the only social worker in my organization, I think the ability for me to determine my caseload or for my team for us to work together on determining, because I wear many hats in my clinic, right? So like SOAR is supposed to be like 10% of my time. It usually ends up being way more than that. On so many levels, but you know, it's a lot of people that don't understand how time consuming a process is. And you want to, when you take on a SOAR case, you want to do a good job, right? It's very time intensive, depending on how many places the people you're serving or working with have been to. You have to read and digest all of the medical records, right? And then you have to like, you know, set it up and line it out. So again, organization. But I think the big thing is that like we begin with the end in mind. Old social work little saying that somebody told me when I was in my undergrad degree program, and begin with the end in mind. And so we're, you know, when we meet people, we try to evaluate all life domains. You know what I'm saying? Just to try to, even if that's not their goal, right? But we try to, you know, do that whole person care. And so I think just kind of in your approach to dealing with each person, I think that also helps you down the road, especially if like the client's goal is not to do that, but you see many efforts at trying to do something another way, right? And so you're ready. So organization, yes, but I think also being able to manage that caseload, because a lot of times people hear SOAR and they just want to call you and give you 15 people on one day. But that also speaks to how much of a need we have in our community. I cannot say it enough. In my community as a local lead, we really need people invested, and we need organizations to be willing to do it, because not everybody is going to be generating income doing this work. So for organizations, it's an investment, and they have to just really care about people and not be worried about the bottom line on this initially in the beginning, you know, but it will be worth it in the long run. So.
And building on what they've both pointed out, I think communication, setting expectations, and consistency are very important. So in building those relationships, both with the clients and with the doctors and the folks at the Social Security office, all those relationships, the consistency and maintaining those open lines of communication are very, very important. And then setting realistic expectations for the SOAR counselor, for the doctors, for the clients, so that they really understand how the process will probably go. Because a lot of folks just have very little experience, and some of the reluctance with the medical professionals in supporting the process comes from just ignorance. They just don't know what to expect. They don't want to get in the middle of something they're not comfortable with. And having those strong relationships, some trust, a lot of communication, and clear expectations can help to make those relationships stronger, and over time build a stronger system and stronger program.
Yeah, and I will say from my experience in Baltimore, the important reminder that there is no one SOAR claim, doing one SOAR claim a year is incredible, and helping even just one person through the process. As we talked at the beginning about how people wear so many hats, that it creates so many pathways to help a person achieve their goals. As Nikki shared with us, the goals of housing, of reconnection with family, of having, in many cases, billable insurance. That is an important access point both for the most importantly for the individual, but also for the health center to be able to, not just in this moment, but for future services that they want to provide the individual and the ability to help that person work through their care plan. It is going to open so many doors, most importantly for the individual, but also for the health center in terms of helping them work towards those health outcomes. And that it is not to think of it as an only being able to help X number of people, but the opportunity to do it. And as Dorothy and Charita were saying, that being a resource for colleagues on being fluent in this language, it really is in many ways the ability to speak in the or understand the disability world through disability determination services and through Social Security. You become fluent in this language that is a resource for your entire organization. So you become a valuable asset, even if the question is not about a SOAR claim, but those relationships that you have formed and the knowledge base, you become an expert in this space that can really have a ripple effect to your entire community, because people will have various different Social Security questions over the course of their lives. We all will interact with this organization at different points, and so it'll be a valuable resource throughout that. I am going to launch our poll just as we wrap up, and I wanted to just pose a final question that might be, Dorothy, to you to start at least, that had come to us, of what should medical respite programs consider when thinking about hiring a SOAR staff, a SOAR trained staff person versus partnering with SOAR trained individuals within the community?
I think it's a question that each program has to look at what resources they have available. If you can have someone on staff, there are a lot of benefits, They're there for you. You can work collaboratively with them about how they're spending their time, make decisions about which clients are assigned to them. So there are some clear advantages to having someone that is exclusively with your organization to handle this, but that's not going to be the reality for everyone. And so if that's not going to work for your program, then certainly collaborating with an outside organization is better than not having it available to your clients at all. So although there are some clear advantages, and I think to the SOAR counselor as well, for being on the staff team, especially in an organization like ours and the one Charita is describing, where you have the FQHC on site. Those doctors, although they would be open to collaborating with somebody from an outside organization, there's a lot of complications in just communicating, right? So they're going to have to get different releases, and they're going to have to do, they don't have direct access to the EHR. They're not seeing one another in passing in the hallway to catch up on how things are going. So there are a lot of things, both planned and unplanned, that can go more smoothly when you have someone directly on staff, even if that's not their entire job. And I understand in a lot of cases it might be one of the hats, right, that they're wearing. But I think it's a huge advantage to have someone on staff if you can make it happen. If that's not yet a possibility for the organization, then by all means find a way to collaborate so that resource is still available. It's still going to be helpful for the clients. It's just going to be maybe not as smooth and easy right off the bat.
Thank you so much. I am so grateful to Kristin, our colleague at the SOAR TA Center, to Dorothy and Traci from Sulzbacher in Jacksonville, to Charita down in Durham, and especially to Nikki for joining us today. I am so grateful for your insight, for your wisdom, for your collaboration on this project. I am really taking with me the message from Nikki to center the human, from everyone that there is not a wrong path here, and that we are bringing with us the connection and the relationships that are formed at all levels to make these benefits more accessible for everyone. Thank you so much for joining us. I'm grateful to Dave and Justin from Empire Interpreting Services for joining us today. I hope you all have a wonderful afternoon. Take good care.